I'm Eric Hermanson from the HR department, and this video we're going to be talking about the Blue Choice Select PPO plan. This plan is only available for employees that live in the greater Chicagoland area. So if you are watching this and you live outside of Illinois and work at one of our other sites, you can stop watching because this medical plan is not something you have an option to pick. Okay, so without further ado, let's talk about how this benefit plan works. It is a standard PPO plan. Most people in America have been on a PPO plan before. It's a very popular medical plan, and the reason is because a lot of our routine medical needs comes from visiting our doctor and possibly getting a prescription. And those types of cases, you pay a copay, and it's $35 on this plan. For prescription, it varies based on the type of prescription you're getting, whether it's a generic or a brand or non-formulary. It goes up in price. Generic is the cheapest and could be as cheap as $5. Typically $5 or $15 is the copay for that. Other types of medical services that an individual may need typically fall under the deductible is paid first, and then the plan pays 80% until you reach your out-of-pocket maximum. So let's talk about a couple examples of that. That would be an outpatient surgery, such as getting a broken finger repaired through a minor surgery, or a knee surgery where you're just in the hospital or an outpatient facility for a few hours and then released. Inpatient hospitalization, having a baby or a more serious medical condition that needs overnight care. That would be another deductible, has to be met first. Urgent care is also a deductible meeting expense. You can see on the screen, emergency room is a $200 copay, so it is expensive, not a deductible meeting cost, but yet still expensive. Chiropractor visits, those are a copay. X-rays and labs, those are a copay. But other types of imaging, such as a CAT scan or an MRI, that would be a deductible meeting expense. The deductible is $1,250 per member on the plan, up to 3. So if you have 4 or 3 or more people on the plan, there's still only 3 $1,250 deductibles, and some of the deductibles would be shared. And then as far as out-of-pocket goes, you can see the out-of-pocket maximum based on the tier, employee only or family coverage. But how deductible meeting expenses work is, let's say I have that knee surgery and it's a $10,000 cost. I would have the first $1,250 applied to my deductible, which would be an obligation I'd have to pay. And then Blue Cross would cover the remaining 80% of that claim. So that's how it would be processed, basically. You want to stay in network, of course, because out-of-network benefits get reduced. So that's how the plan works. You get a medical card when you sign up for it. You have your copays and your deductible meeting expenses. So if you have any specific questions, by all means, feel free to reach out to us. We're happy to help. Thanks a lot for watching.